Well, thank you, Reverend Kathy. It's an honor to join you all today, and I'm so glad that we get to continue with our Composium Beyond Borders. When Reverend Kathy and I were brainstorming about topics for this presentation, we agreed that most importantly, that these are challenging times and that we all need that extra layer of support right now. And so if you are feeling overwhelmed, stressed out, maybe having trouble sleeping or feeling a bit nervous or sad, you are certainly not alone. And I hope you feel today enveloped in that warmth and encouragement that we all hope to bring to you. I know in patients who are speaking with me, they're juggling a lot and really starting to feel that their cup is overflowing. And so I'm here today to talk about some ways to hopefully get you a bigger cup and take some of the burden off. What some patients are telling me, for example, they started out with the things that they were expecting, maybe a cancer diagnosis or the treatments that have been planned, all the appointments. Maybe it's a little easier now with video visits and not having to rush around quite so much. But now add on the uncertainty of the coming school year and having to do childcare while working your job, or maybe you're unemployed or furloughed, or that financial plan you thought you had is out the window and everybody in the family is stressed and oh my goodness, how do we manage? We are overflowing. And so when I talk with my patients, they often want me to figure out what was the thing that overflowed the cup that they can fix. But I'd like to tell you a little suggestion that works well for my patients. Don't worry about that at all. It doesn't really matter, whatever it was that finally did us in. Two things matter that we're going to work on today. One is, how do we get you a bigger cup? Because if we can build your resilience in the midst of all of this, if you can feel calmer, sleep better, have more peace in your family, then all those things that are overflowing the cup, they become a little more manageable. Secondly, rather than worrying about what overflowed the cup, think about what's the biggest thing that I can pull out of here that I can work on easily. And so while I'm a physician, my patients are often surprised that sometimes I'll be chatting about referrals to a financial planner or a parenting coach or a really good book on grandparenting, because ultimately, whatever is overwhelming you the most, if you can fix it easily, that's the thing to go after. So that hopefully, with taking that one thing out, you find that you've got some more space in your life. So today I'm going to talk particularly about how do we build a bigger cup? How do we add some resilience into these challenging times? And I'm going to start by chatting about some of these lovely plants that Reverend Kathy brought us that I see as powerful allies in this. And so you might have some lavender growing in your garden or your neighbor's garden, or you might even have some in your tea cabinet. There are more than 6 published clinical trials on the effectiveness of lavender for anxiety and depression. Works on the same brain receptor that the drugs Ativan work on, or lorazepam, but fortunately without the addictive properties that those drugs can have. And so this is a tool we can comfortably and confidently use. And there's lots of ways to use it. You might take some of your lavender clippings and make a tea. Or you could do some aromatherapy with lavender oil. For my patients who are running around these days, they really love the convenience of pills, that you can just keep this in your purse or briefcase, and one of these twice a day helps keep things calm all through the day. So that's a really nice tool. These are very well tolerated, and really the only thing we have to watch out for is you can get a little bit of a lavender flavor coming up. But many of my patients tell me that they'd much prefer lavender burps to Ativan, so, pick your pleasure. Another thing from your kitchen cabinet that might surprise you in its benefits is saffron. This Middle Eastern spice, we use it to turn our rice red if we're making a rice salad. Again, more than 6 clinical trials on this specific ingredient, beneficial for mild to moderate anxiety and depression. Levels of benefit equivalent to what I can achieve by prescribing a patient an SSRI drug, but without some of the side effect trade-offs. Just like SSRIs, it takes about 12 weeks to kick in. And so if you're going to make this a part of your routine, make it consistent. Now, you certainly can enjoy it as a food. I got this at Trader Joe's. However, it is also available as pills, and so for a lot of my patients who are feeling a little overwhelmed and they don't want to cook complicated Middle Eastern food, that can be a good way to go. The next powerful plant I'd like you to think about is passion flower. I have mine in a nice evening tea here. You can also get it as a liquid herbal extract, and it can be very beneficial for anxiety. Again, in a clinical meta-analysis, more than 6 clinical trials showing benefit for that, and with very good tolerance, not having the dependence issues that we have with some of the prescription drugs. I know St. Charles every year has a pain management conference where we physicians all get together and we talk about how can we use less of the benzodiazepines, the calming drugs, because we have profound safety concerns. They are very useful short-term, particularly patients on chemo when they need them, but whenever we can find a gentler alternative, I think that's a really wonderful thing. So those are 3 of my favorite plants for calming. Some other helpers that you might bring along with the way might be chamomile, which you can see you can harvest in your garden and make a tea out of, or if you're in a hurry, have a ready-made tea. Some others that are really lovely, magnolia, which if any of y'all are from the South, you might remember it fondly from your yards. Magnolia binds to the GABA receptor, which is the same receptor that Ativan binds to, so really nice, gentle, calmer. And then ashwagandha is another lovely one for building our resilience. I'll talk more about that in a little bit. The next thing I want to talk about is the art of resetting our brains. So these powerful plants are a really good helper when you're just overwhelmed and you need to take a breath. And then you might notice in these difficult times that the tools that used to work, your prayer practice, your meditation, the walks in nature, they're still helping, but it's just not enough anymore. You need some way of shifting your brain from an overwhelmed state to a calm state. And so there are a few tools that we can bring into play for doing that. Some of you who joined us for last year's Composium might recall our conversation about the alpha stim. This is an electrical device. It's a microcurrent, and you clip it to your ears, and then can clip it to a belt loop. And so what's really nice for some of my busy patients is that I can still work or do the dishes or sweep the floor or whatever I need to do while wearing this, and a 20 to 30 minute session a day will start to dramatically shift brainwaves. Multiple clinical trials have shown that this is effective and FDA approved for treating anxiety, depression, and insomnia. The Veterans Administration is currently doing clinical trials to look at its use for PTSD. In our military families as well. So I think that can be a really valuable tool. It is something you need to use for several weeks to notice full effect. I offer it as an in-office treatment for those who just want to try before committing, but if it is something you're going to make part of your toolkit, I would suggest planning to rent one for a couple of months so you can really get the hang of it. And other ways to kind of reset your brain, there's another software called HeartMath that has an app that you can actually get on your phone, which is a form of biofeedback, which will allow you to entrain the nervous system that lies in the heart, which has very powerful calming benefits. I particularly think of HeartMath if I am working with a patient where I'm concerned about their cardiovascular health, because there's robust research about how we can decrease risk of cardiovascular events through this biofeedback therapy. And of course, I love chatting with my patients about any kind of meditation. And patients will often ask me, well, doctor, there's so many different kinds. What kind should I do? My first question is, have you had success with anything before? And what will you actually do? Yes, there is more research, for example, with mindfulness-based stress reduction techniques, so I love to go to those. But if you've been practicing 4-square breathing or alternate nostril breathing or whatever works for you, go for it. If you have no place to start, I would say one of the simplest would be deep belly breathing or diaphragmatic breathing, and I'll show you what that looks like. So go ahead and join me now if you can, and place one hand on your belly and one on your heart. And what we're going to be working at is getting the hand over the belly to move a bunch while the hand over the heart stays still. And so we're going to take a breath in. Breathe in, big belly. Breathe out, small belly. Breathe in, big belly. Out, small belly. So it can be as simple as that, even 5 minutes a day, giving yourself that reset. With women, I talk a lot about body positivity with that. Many of us have been raised for decades to suck our tummies in and not live in our bellies, and it's great to just get permission to enjoy a great big belly and all that it wants to offer us. When we are stressed out, we generally breathe all up in our chest, which means we're using what are called the accessory muscles of the chest to do most of the work of breathing, and that is exhausting, actually. When we belly breathe, we are using the diaphragm and our core muscles of our stomach, which is a much gentler way to breathe, and it also activates the parasympathetic nervous system, the calming nervous system. So that can be a really good tool. So if you find yourself waiting in a doctor's office and the doctor's running late, or waiting to get yet another scan and worried about that scan, that can be a nice tool to pull out in the waiting room. And it's subtle enough that you can kind of hang there. Nobody has to know what you're doing. So those are some of the tools to reset. One more I want to mention is our friend magnesium. This is particularly magnesium glycinate. There are many forms of magnesium. The glycinate with its glycine component is going to be one of the most calming. Glycine is itself an inhibitory or calming neurotransmitter, so we're giving it that. And magnesium does several interesting jobs. It binds at the NMDA receptor, which is the same receptor that opioids work on, and so it can help with cramps and pain particularly. The other thing is, in 2 key locations, it works on a stress hormone cortisol, which we'll talk more about in a little bit, blocking our ability to both make and process that cortisol so that we feel calmer. I'll get into that more when we talk about how cortisol acts in the body. So we've talked about powerful plants to help us along in feeling calmer. We've talked about some strategies for resetting our brains. With Brain Reset, it's important to make a commitment that you are going to have a several-week practice in order to feel results. Expect that it will feel awkward at first, and that is okay. Even if you feel like you're doing it wrong, you are doing it right. And one of the things that I tell my patients is it will get easier because neurons that fire together wire together. So the more you keep your calming practice of meditation or prayer or alpha stim or whatever you do, the more that you're going to create those new pathways, and it will get more graceful, it will get easier. Next, I want to talk about the art of shifting our perspective. I had one patient come in to me who was very worried about her daughter. Her daughter's been acting out since she's been doing online school. Many parents are experiencing that. And she came to me concerned that maybe her daughter actually had a mental health disorder, perhaps OCD or an anxiety disorder. And as she started telling me about the behaviors, it became clear to me that actually what I thought was going on was that the daughter was trying to express feelings that had nowhere to go. And so I shared a book with that patient. It's called How to Talk So Kids Will Listen. It's a classic from the 80s. It's kind of old school, but it's one of my favorites if you have a child you love who's in a bit of trouble. And the bottom line I've learned from that book that I also think is valuable for adults is this: all feelings are always okay. Actions have limits. And I would invite you to shift perspective. It can be really difficult when we're feeling fear or anger or sadness. We start to feel, well, if I feel this way, I can't let myself feel it because I won't get out of it. Or I might do something terrible because of it. And it can be, or I might become a different person, someone who's scared or angry. And what I'd like you to do instead is play with the idea of seeing your feelings as if they were a thunderstorm that's going to roll in and roll out. It's just today's weather. It doesn't necessarily mean anything. It's the state we're in. In the show notes from today, I'll have a few handouts to share with you, and one of them I'd like you to play with is a very simple exercise on how to begin to see your emotions as weather patterns. And what patients have shared with me as they've done this exercise is that a tremendous burden gets lifted off their shoulders because it is no longer their job to police their emotions or to worry that something's wrong with them because of their emotions. And interestingly, when we deal with our emotions, it kind of is a lot like when I deal with a tantrum from my 2-year-old, which is that the more that I roll out the red carpet for that tantrum, I regard it as like the best, most detoxifying thing ever, the less it happens. Because now my son is not pent up with all these emotions that he can't get out. He has full freedom to express them until he's done. And I think children are wonderful teachers like that, because he can be screaming his little head off and punching the floor, and 2 minutes later he just gets up and walks away as if nothing happened. And that to me is just the most inspiring example of free expression of emotions. One of the other ways to think about this that resonates for some of my patients is think of it like vomiting, as strange as this might be. If you were caring for a sick child who was vomiting, would you tell them to swallow their vomit? No, right? We want it out, because getting it out is what heals. It's the same way with these difficult emotions. The next thing I want to share with you about shifting our perspective is seeing it as an opportunity. I know a lot of my patients are reasonably worried about post-traumatic stress. Will the distress, the anxiety that they're under right now create bigger problems down the road they have to deal with? And it might, and there are things we can do to help decrease that risk. However, researchers at Stanford give us hope, which is that another thing that can happen is what's called post-traumatic growth. And that's the psychological science of understanding how is it that some people faced with very difficult circumstances are able to find deeper meaning, deeper purpose, grow in their characters as a result. And what the Stanford researchers are telling us, there's a couple of key factors. One of them first is to see this process as a journey rather than an end result. So rather than seeing as, how many more months do I have to slog through this stupid COVID thing, which I wouldn't blame anyone for thinking, I'm sure we're all thinking it, see it instead as, life is really different right now, and how can I adapt, and how can I get the best out of it? And so some of my patients are telling me, for the first time I'm stuck at home, I'm cooking, and I'm making really nourishing food, or I'm FaceTiming my grandma a lot more. I really enjoy talking with her. We have the time now. Or they're taking up new exercise practices. So post-traumatic growth can mean, in a difficult circumstance, how can we see it as an opportunity? So another handout I'd like to share with you is an article from the Stanford Business Review that will talk a little bit about ways that you can set yourself up for the opportunity of post-traumatic growth if you'd like to. So that's what I wanted to share about perspective shift. The next piece in challenging times that I like to share with my patients is how to reestablish the foundations of good health. And that's a core naturopathic principle. So often a patient will share with me their difficulties and the things that are changing, and I'll ask them questions like, have you been able to get out and sit in the sun this week? Have you been able to get out in nature? How's your diet? How's your sleep? Are you moving? What kind of movement are you doing? And those might seem like the most mundane things. The truth is, though, that when we don't feel well emotionally, we tend to ignore those basic pieces of self-care, and then that just further drives the problem. It's particularly common in depression, where we don't have the energy or the drive to do those pieces of self-care. And so make it really simple. It may just be that you are going to eat a more nourishing TV dinner and you're going to go sit in the sun for 5 minutes. But try to layer in those foundations. The next thing I want to talk about that may be a little surprising to some of you is the research around the role between inflammation and depression. It appears that part of what happens in individuals who are struggling with depression is that the brain is inflamed, and that calming down that inflammation may actually be helpful in elevating mood. We see that a measure of inflammation called C-reactive protein can be very elevated in these individuals, and that certain anti-inflammatories, particularly curcumin or turmeric, can be helpful. And we can enjoy curcumin in many different ways. One of the simplest would be a ready-made golden milk product like this. So this is a powder that you just mix in a little bit of whatever milk or non-dairy milk you like to use, and can drink it as a warm tea. I would encourage, so that it's not clumpy, put just a little bit of that milk in your cup, mix the powder in, and then add the rest of the milk. And it's like an herbal chai. And in a randomized trial, curcumin was effective for mild to moderate depression. You do, like most treatments for depression, need to take it for a period of at least 12 weeks to get benefit. There are, short of ketamine, a prescription drug, there are very few short-term treatments for depression. The other anti-inflammatory that has some research in depression is fish oil. And in a double-blind randomized trial, fish oil helps to reduce anxiety symptoms by 20%. Not a magic bullet, but certainly an incremental helper. Fish oil and things like chia and hemp are called essential fatty acids, and by that it means that they are essential for the functioning of the body. If we do not eat them, we cannot make them. And so I talk with my patients a lot about cooking up some chia pudding for breakfast, maybe sprinkling a bit of hemp seed on a salad. For those who are just too busy to cook, we chat about fish oil supplements as well as being a good option. As a naturopathic physician, one of my other core principles, whenever possible, is to treat the cause. And so there are some lab tests that can be helpful when I'm evaluating a mood disorder. So I do look for, is the thyroid function dropping off? If we're seeing depression, is the thyroid functioning too rapidly, or what's called hyperthyroidism in anxiety, are important things to rule out. I also look for several nutritional deficiencies. So if ferritin is low, that could indicate not enough iron in the body. If ferritin is high, that could indicate inflammation. Deficiencies of zinc, vitamin D, vitamin A also can all be contributory, and then certainly deficiency of magnesium. And magnesium deficiency is very common. With conventional agriculture, our soil is unfortunately quite depleted of magnesium, and many prescription drugs, if you're taking them, can also deplete magnesium as well. For those of you who maybe are on steroids as part of your cancer treatment, steroids are significantly nutritionally depleting, and so we have to be sure to balance that out. Next, I alluded earlier to talking about cortisol, and I want to discuss that a little bit more now. Cortisol is a stress hormone, and it's also a hormone that helps us digest our food, particularly in regulating our blood sugar. We need cortisol to function, but imbalances of it can cause serious problems. Healthy cortisol should be high in the morning to wake us up like a good morning cup of coffee. It should be moderate midday to keep us working and going through the day, and it should be low at night to let us sleep. What we see in clinical trials of cancer survivors is a couple of disturbed patterns happen. One of the first levels of disturbances that happen is called a flip pattern, where you are exhausted when you wake up in the morning, wired at night, can't sleep. So when it should be high in the morning, it's low, and when it should be low in the evening, it's high, right? That particular pattern is also elevating nighttime cortisol. A couple of things with that. One, it's very common in cancer survivors with anxiety. Two, it's very easily treatable with integrative medicine, and I'll share some of the tools with that. If we don't catch it at the flipped rhythm phase and we let it keep going, the next thing we can develop is a flattened rhythm, where you're pretty much exhausted all day. I particularly see this a lot in patients who've been on steroids longer term for a while. They get taken off the steroids without good adrenal support coming off, and now their own adrenal function doesn't come back on board the way we'd like. And that is a problem, one, in terms of how you feel. It can contribute to the persistent cancer-related fatigue, which is one of the most common side effects of cancer treatment. There's also research that indicates that a flattened cortisol rhythm increases our risk for cancer coming back in several cancer types, particularly in lung cancer, renal cell carcinoma, and metastatic breast cancer. And I say that not to be scary, but hopefully to be empowering, to say that there's a reason that we need to work on this. So addressing our mood needs, yes, it's self-care, yes, it feels good, but also can have powerful effects in terms of cancer prevention as well. So now let's dig into the tools of, okay, so we've got a cortisol problem. What do we do about it? So first of all is to telling if you have a cortisol problem. Some of it I can tell purely on symptoms and history, some of the things that I shared. If the situation's unclear or I'm not sure, then there is some testing we can do. There's a blood test that's a screening tool. It's the one that my allopathic colleagues commonly order, which is a morning cortisol. If it's abnormal, then yes, we have a problem. But if it's normal, it's not a complete answer. And so at that point, what I prefer is a salivary cortisol panel that's done throughout the day so that I can also detect the rhythm problems rather than just a total level. And then in terms of tools, when we have a high nighttime cortisol that can often interfere with sleep, the magnolia that I talked about earlier is a really nice tool for addressing that, as is the magnesium glycinate. Phosphatidylserine, which I unfortunately don't have a bottle of, is another great one, where phosphatidylserine can help to significantly lower those cortisol levels. If you're low all day long, the person who's just really depleted, then I start looking at plants that are called adaptogens. The Soviets were the ones who did this initial research as they were trying to build the capacity of their military, looking at plants that would give people more endurance in the face of difficult circumstances. And so the ashwagandha that I spoke about a little bit earlier is one example of that. Reishi as a medicinal mushroom is another. I like both of these when my patients are struggling with anxiety because they are both calming, very, in Chinese medicine, yin tonifying herbs, and so they're going to build a person up without overstimulating them. And reishi has some interesting data. It was studied in breast cancer patients on hormonal therapy in a clinical trial and found to improve fatigue, anxiety, and depression. So can be useful there. And then the other essential piece in cortisol management is diet, and that's why I brought some of these food options. When we've been on lockdown, many patients are telling me they're baking more, and because they're stressed out, maybe they're going for the sugar and the simple food more. And unfortunately, that creates a bit of a vicious cycle because those refined carbohydrates are going to cause a blood sugar surge. And then in response to that, the body's going to release insulin, the blood sugar is going to crash down, and then when we are hypoglycemic or in a low blood sugar state, the adrenals will release cortisol to communicate to the liver to try to make more sugar out of our glycogen stores. And so we will get this cycle of sugar, insulin, cortisol over and over again and deplete the whole darn system. And so an important part of the way out is to change our diets to remove a lot of those simple sugars. Now I get the desire for comfort food, and so some of the tools I brought are ways that we can enjoy our comfort foods and be kinder on our bodies. And in the show notes, I'll share with you a handout to my favorite paleo chocolate chip cookie recipe. So you can enjoy treats without the junk. And it really takes a couple of simple ingredients. One, we really have to deal with the sugar in the flour. So for the flour, almond flour makes a really nice replacement. You can buy it ready-made from Costco or other vendors. If you've got a great blender, you can just blend up almonds and make it that way as well. And then the sugar, we have several good alternatives. And of course, I'm looking for healthy, natural sweeteners. This is not your grandma's Splenda, right? The favorite in my family is allulose. This is a natural sweetener made from kiwis and raisins. It's available as a liquid or a powder, and it just has a really clean flavor. It doesn't have a bitter aftertaste. For patients who are really sensitive, I like this one because it doesn't tend to give people jitters or headaches, which can be problems with some of the other alternative sweeteners. So if you're a sensitive person, this might be a good place to start. For those of us with kind of sturdier constitutions, some other good ones. Lancato is a mixture of monk fruit and erythritol. And then this is plain erythritol that I got at Natural Grocers. I do want you to be mindful with the sugar alcohols like erythritol or xylitol. Two things to know. One is if you get diarrhea, you've eaten too much. The second thing is strictly keep it away from your pets. The sugar alcohols can be deadly for cats and dogs particularly if they got a chance to lick something sweet might go for it. The other option, of course, is stevia. I don't have a package of that here, but that's available in powders and liquids. And if you like and tolerate stevia, that's a great choice. And the way to know if you do or don't tolerate is if immediately after consuming stevia if you feel headaches, or if you feel anxious and jittery as if you just had too much coffee. Those would be indications that it's not the sweetener for you. So those can be some great ways to enjoy chocolate chip cookies or other kinds of baking while keeping your cortisol levels nice and level, and who knows, maybe even trimming our waistlines eventually a bit. I know a lot of patients have been telling me they've been struggling with the COVID-19 pounds through all of this. And then we talked earlier about magnesium, and I wanted to be a little bit more specific about its relationship with cortisol. It works in a couple of places. One, the master hormone that activates a cortisol surge is called ACTH, made in the brain. Magnesium helps to slow activation of ACTH in response to stimuli. Secondly is if we go ahead and make our cortisol, magnesium helps to slow the entrance of that cortisol into the brain through the blood-brain barrier. And so one physician I know calls this the original chill pill. Of course, if you take too much magnesium, you can get loose stools, so be mindful of that. Better absorbed forms of magnesium, like magnesium glycinate, tend to cause that problem less, whereas magnesium oxide would be a tool I'd use only in patients who are constipated, where we're actually really trying to not absorb the magnesium. So we've covered cortisol balance. And so in the show notes, I'll have some more information about seeing our emotions as weather, building up our capacity for post-traumatic growth. I'll have a recipe for making your own golden milk out of turmeric if you prefer to cook from scratch. And we'll also have a recipe for those guilt-free chocolate chip cookies. And I will tell you, I'm a mother of a 2- and a 4-year-old. I make a version of these cookies with dried fruit and nuts instead of chocolate, and absolutely guilt-free feed them to my kids for breakfast. They are that nutritious and tasty. And so my hope today in this conversation is that you've gathered some tools that you'll be able to use to take that overflowing cup that you've been struggling with and maybe take a little bit of the water out and build a bigger cup so that you can benefit from the refreshment of today's presentations. I'd like to thank Reverend Kathy and Father Jim for inviting me to speak today. It's a pleasure to join you, and I wish you peace and comfort in these challenging times. I hope you enjoy the rest of the day.